So not everybody that comes to us has breasts that are truly symmetrical. There's always a degree of asymmetry. We always say that breasts are not mirror images of one another. They're more like sisters than twins. Our biggest goal is to make sure that ultimately the volume and the size is the same. So in some cases, the nipple position can be lower and we need to raise one. Sometimes it's just a volume difference, and so we need to put more volume in the smaller one. And the techniques that we can use implants, we can use fat grafting, and we can use lifts. So basically, literally lifting the whole breast, including the nipple and the areola, up. So this is a young, healthy 18-year-old who basically came to us saying, I can't go to the pool with my friends. I can't wear the things I want to wear because I have such a difference in my breast. And you can see that the right side is considerably smaller. It's a little bit more narrow as well. The left side is actually lower and kind of is what we call ptotic, or sort of droops. This crease is higher than this crease, so we need to account for that and get this crease to where it better matches this crease. We need to lift this side up, and then we need to make this one bigger. So what we did in her is we put in a very small implant over here, and then we filled it around with fat because we couldn't put too much of an implant in, because otherwise it would overpower and now make the left side smaller than the right side. And all she really wanted to do was make this left side lifted and give a little bit of fullness in that area. So we used fat from her tummy area, and we then put in the small implant, did fat grafting around it, and then on this side lifted the breast up and actually put a little bit of fat at the top here. So one of the added benefits of doing it this way is we took fat from the abdomen here, and now she's got a smoother contour overall. Her waistline is better defined, and she's got markedly improved symmetry between the right and left side. So this is a little bit of a magnified view, same view. She's at 7 months now, so all the fat that I put in there is pretty much going to stay now. We used to quote people about maybe a 50% take with the fat, but now it's up to 70, maybe even 80%, because we've got a brand new system that basically allows us to process the fat and just get better overall results. So last view here, you can see nipple position was considerably lower on her left side. The whole breast was just, more drooping, and then the right side just needed to be filled out. And so now, again, she's got very similar size, and she's got very similar shape. So she can wear anything she wants to wear, and now even out of clothes, her scars have really faded well, and you really can't even tell that she's had anything done.